Welcome to This Explainer. You know what's incredibly frustrating? Getting a root canal, going through all those appointments, the injections, getting the crown fitted, finally thinking the problem is solved, and then it still hurts. If you're sitting there right now wondering why a tooth that's already been treated is suddenly giving you grief, I want you to know you are absolutely not alone. It's actually one of the most common and honestly most confusing situations patients deal with. So today, we're going to skip the dry textbook answers. We're going to visualize exactly what is happening inside that tooth and explore why a second procedure, called a root canal retreatment, is often the absolute smartest path forward. Right off the bat, let's address the elephant in the room. Is it actually normal for a root canal to hurt? There's this dangerous misconception floating around that pain is just part of the deal. Let's be crystal clear on this. Having some mild soreness for a few days right after the procedure? Yeah, totally expected. But lingering pain, reoccurring swelling, or sensitivity that sneaks back weeks, months, or even years later? No way. That is a massive alarm bell. Your tooth is literally telling you that something needs attention, and just masking it with painkillers is definitely not the fix. Here is what we're covering in today's explainer. Why treated teeth hurt, hidden causes of reinfection, diagnosing the invisible, the retreatment process, retreatment versus extraction, and finally, saving your natural smile. Let's dive in. Part 1. Why treated teeth hurt. Okay, so during a successful root canal, the entire goal is to remove the infected pulp, that's the soft tissue packed with nerves and blood vessels, clean the canals out thoroughly, and seal them up tight. Once that's all done, technically speaking, the tooth is essentially dead. It has absolutely no nerve supply left. Yet, it stays highly functional in your mouth for chewing. And this is exactly why recurring pain is so incredibly confusing to patients. If there's no nerve left, what on earth is actually hurting? Which brings us to part 2, hidden causes of reinfection. Here's the secret. The pain you're feeling isn't coming from the inside of the tooth anymore. It's actually coming from the surrounding bone and tissues, reacting to a lingering issue. There are usually 6 main culprits here. Sometimes there was incomplete cleaning and microscopic gaps were left behind, or new decay managed to restart the infection. Actually, sometimes it isn't even an infection at all. It could just be a high bite, meaning your brand new crown is sitting just a tiny fraction of a millimeter too high, creating excessive pressure every single time you bite down. The crucial takeaway here is that this is a mechanical and biological problem. It is not your fault. You have to remember, human anatomy is messy. Human teeth aren't the perfectly straight lines you see in textbooks. If we were to look at a 3D cross-section of a lower molar, you'd see that the canals can be incredibly narrow, sharply curved, or even completely hidden behind other structures. It's like a microscopic maze. If even a single tiny branch of a canal gets missed during that original treatment, bacteria are just going to keep right on thriving inside it. It's one of the most common reasons a root canal fails, but luckily it's also highly fixable. Another huge culprit is what we call coronal leakage. Think of your sealed root canal as a highly protected vault. If the crown or filling sitting on top of the tooth develops even microscopic gaps, the vault is breached. Saliva, which is absolutely loaded with oral bacteria, seeps right back down into those previously cleaned roots. Over months or years, those bacteria travel all the way down to the root tip and actually start causing bone loss. Let's look at part 3, diagnosing the invisible. You can't fix what you can't see, right? At clinics like Apollo Dental Nallakunta, specialists aren't just guessing. They're bringing in the big guns with advanced tech like CBCT. That stands for Cone Beam Computed Tomography. This scan takes us way beyond those old, flat 2D images. It gives the dentist a complete 3D scan of the tooth, the canals, the root tip, and the surrounding jawbone. It literally lights up the hidden anatomy and the invisible infections that regular x-rays just totally miss. With those 3D scans and a good clinical exam, specialists are looking for hard evidence to step in. If you've got pain lasting for weeks, swelling, maybe a tiny draining bump on your gum called a fistula, or if the scans literally show bone loss and missed canals, those are undeniable, flashing red signs that it is time for a retreatment. They don't just act on vague symptoms, they act on clear visual proof. Part 4, the retreatment process. Root canal retreatment, often called Re-RCT, is essentially undoing the old work to do it perfectly anew. Step 1. The dentist carefully removes the existing crown so they can get inside the tooth. Step 2. They dissolve and clear out all the old filling material. Step 3 is the absolute most critical part. Using those 3D maps we talked about, they track down those previously missed canals, then reclean and reshape everything. Finally, step 4, they precisely refill and seal the tooth up and cap it with a brand new crown to protect the vault. And hey, you aren't going through this with outdated, clunky tools. At Apollo Dental Nallakunta, experts like Dr. Neela Shiva Tarun, who is a specialist in endodontics, perform this using super precise modern rotary file systems. We aren't talking about the old hand filing techniques of the past. Rotary files improve accuracy massively. Plus, the whole thing is done comfortably under local anesthesia, usually wrapped up in just 1 or 2 quick sittings. Part 5. Retreatment versus extraction. When you're sitting there deciding between a retreatment and just pulling the tooth to get an implant, keeping your natural tooth is almost always the preferred first option, assuming the tooth is structurally sound, of course. Retreatment actually preserves your natural tooth, requires a moderately complex procedure rather than full-blown surgery, takes way less time, again, just 1 to 2 sittings versus 3 to 6 whole months for an implant, and it generally comes with a much more moderate cost. 75 to 85%. That is the success rate for root canal retreatments when they are performed by an experienced endodontist using modern tools. That is a highly viable, really strong data-driven reason to give your natural tooth a second chance. But we do have to be completely objective here. Re-RCT isn't magic, and it's honestly not the right call for every single scenario. If you have a vertical root fracture, meaning the root is literally cracked on the side, bacteria are just going to keep flooding in no matter what. In that case, extraction in an implant really is the most durable solution. Or if the infection is strictly confined to the very tip of the root, they might recommend a minor root end surgery called an apicectomy instead. The ultimate goal is your long-term health, not just pushing a single procedure. Finally, Part 6. Saving your natural smile. Dealing with a failed previous treatment is frustrating enough. Getting it fixed shouldn't be a nightmare too. That's exactly why facilities like Apollo Dental Nallakunta, located right on Shivam Road, are designed to make this as smooth as possible. They bring the 3D scanning, the dedicated endodontics specialists, and a coordinated prosthodontics team, the folks who make your crowns, all under one roof. You aren't bouncing around between multiple clinics just to get your retreatment and your new crown sorted out. I really love this philosophy from their team. Every tooth and every patient deserves individualized care and attention. Listen, coming back for a second root canal can make you feel let down or super anxious. But a great specialist team is going to explain clearly why that first treatment didn't hold up and tell you exactly what they are going to do differently this time to ensure it succeeds. So I'm going to leave you with this final thought today. If your tooth is sounding the alarm with lingering pain, what's your next move? Will you just mask it with painkillers and let that hidden infection grow? Or will you take control and save your natural smile? Getting evaluated early always gives you far better, way more comfortable options. Don't wait on it, get it checked, understand your 3D anatomy, and take the right step toward lasting relief. Thanks for joining me on this explainer, and I'll see you next time.